us off into another part of the NHS, the hospital laboratory. Here we have other very highly trained health professionals who will look at the blood and work out what's going wrong with the patient.
I could have told you that.
Okay, so they're not quite 500 here, but it means that perhaps one or two of the guys sitting in this audience might have inherited it. Okay? If at the end of this presentation anyone who's in the least bit worried, come and see me afterwards, okay? Right, so what are the signs of FH? Well, there's a sign of high cholesterol is a white line in the eye. It's called corneal arcus. When they have children, there are 4 possibilities, 4 combinations.
So there are 200 different types of arthritis that we know of, but the most common and the ones that you've probably heard of are osteoarthritis and rheumatoid arthritis. And the difference between them, really very simply, is that the osteoarthritis is known as the wear and tear arthritis. So the older you get, if you get damage to your cartilage, then you get pain and development of cartilage breakdown, etc. But rheumatoid arthritis is slightly different. It's actually a disease of the immune system, and it's where the body actually attacks its own joints. It's quite a severe disease. However, modern medical knowledge, we know quite a lot about what goes in an RA, and we know how we can sort of modulate the disease.
What we have here are some leukocytes, freshly isolated yesterday on my right, and some leukocytes which have been treated with ethanol here on my left. Obviously,
so the darker the blue colour, the more TNF you've got in that sample. So if you guys want to add in the stop solution, the same as you did the colour substrate, so C tips, just be a bit careful because it's acid. So just don't go splashing it over yourselves. And what we should see here then is the blue colour will change to yellow. So yeah, just stick back on, that happens with those kind of effects.
So what does this do? It stops this?
Yeah.
you're going to be randomised to. So far we've got 2 control groups, and you are a treatment group. You're going to have to cover one eye with your non-throwing hand to try and get into the hole.
10,000 people to come out.
That is much harder to do.
The purpose is to gather iron in the blood, because once bacteria are in the blood system, they find it quite difficult to find iron, and that's what that does. Once we've got a bug on a plate, if it's causing someone a problem, the way we have a look at its antibiotic susceptibility is to do this. This is an agar plate that's been swabbed entirely with Staph aureus. If it was left alone, it would grow up overnight. This ring is full of different antibiotics, so each nodule has a different antibiotic in it.
Oh!
You already get one.
Do it again.
Oh, yeah, go on.
My throat.
Did it?
Oh my god.
Did you get it that time?